Being a doctor, it can be challenging if you're on Medicaid, but that may be about to change next month. The state plans on giving more money to doctors treating Medicaid patients, but as Lindsay Veramis explains, the biggest change is not set to happen until next year.
Michigan doctors are bracing for a tidal wave.
The number of patients in Michigan who are covered by Medicaid has gone up. It's at the highest levels it's ever been, yet simultaneously they have a hard time finding access for these patients to care.
While many physicians want to treat the low income, they say they need to make a living. Under Medicaid, patients usually pay nothing for covered medical expenses.
When you're seeing a patient for $26, $27, $28 a visit, expected to spend 10, 15, 20 minutes with that patient, it doesn't take long to figure out you can't make ends meet.
The government reimburses doctors for some of the expense, but with many coming out of medical school with loans nearing $200,000, it's not enough.
It's as if they bought a house they're never going to live in. So layer that on top of the cost of maintaining a practice. For a lot of specialties, particularly primary care, family medicine, pediatrics, general internal medicine, the margins are very, very thin, and they've gotten thinner as time goes by.
Hoping to change that, states and the Affordable Care Act will increase reimbursements. In 2013 and 14, Medicaid payments for primary care will be the same as Medicare.
In the short run, that improves access, because for a lot of physicians, one of the biggest barriers to taking care of Medicaid patients was finance.
But he worries the improvement will be short-lived. After 2 years, the payments diminish.
So physicians, particularly those just getting started or those in the middle of their careers, are going to take a look and say, wait a minute, for 2 years I'll be okay, but then what do I do with these patients that I'm willing to see now when I can't make a living with them again? Where are we with that?
In Lansing, Lindsay Veramis, Fox 47 News.
And doctors are watching very closely to see if the Affordable Care Act is repealed. Physicians we spoke with say even if the law is tossed out, health care needs to change because it is simply too expensive.